Good day, I am Mark Joshua Rivera from BSN3E. For today's video, I'll be demonstrating tracheostomy care and suctioning. So for the first video, I'll be demonstrating tracheostomy care. The first thing we need to do is to perform hand hygiene. Next, provide client privacy. Then, identify the patient. Then, explain the procedure to the patient.
Good day, ma'am. I am Mark Joshua Rivera, your nurse for today. Do you experiencing any pain, ma'am?
None, sir.
Okay, good. Can you state your name and birth date, ma'am?
I'm Jamie Cacho. I was born on January 30, 2001.
Okay, good. I'm just gonna set up the needed equipment for today's procedure, okay, ma'am?
Okay, sir.
But before we proceed, let me show to you what is going on here. So, this is the trach collar. This provides oxygen to the patient, and they have their dressing, which you can tell looks a little bit dirty and needs to be changed. Then they have the trach ties, which is keeping it in place. And then this is the inner part or the inner cannula, and here's the outer part. There are a couple of different trachs you can see. There are some trachs that doesn't have inner cannula, and that's fine. So the use of this inner cannula, it's like a safety thing in the trach to prevent mucus or any other like airway obstructions. This inner cannula is the thing that we had to take out to clean. So now let's get started. So we have our trach kit and our normal saline. This is going to be partially sterile, so it is recommended to open up the normal saline first. And now we're gonna open up our trach kit. Remember, when we open a sterile kit, we open it away from ourselves. Next is to apply my sterile gloves. Now I'm gonna set up my field. So take this drip out, and remember, shiny side down. Then we can take all of our supplies. So we have the pipe cleaner to clean the inner cannula. Next, we have the cotton tip applicators. These two are going to clean around the site closest to where the trach is inserted. And lastly, we have the gauge pad. There are two different gauge pads in here. I've got regular 4x4 and we have a finished treated dressing. So this is our dressing with a little slit in it that's gonna go around the trach when I'm finished. I'm gonna keep one hand sterile and I've got one hand clean. Keep in mind that your sterile hand should be your dominant hand. So my dominant hand was my right hand, so I keep it sterile. Now I'm going to use my left hand to pour my normal saline into my bucket here. I'm gonna pour 50% saline into the large compartment, and then the other 50% for the two compartments, so 25% each. Now, I'm gonna use my left hand because it's my contaminated hand to move the tray collar. And always remember that you want it readily available because the patient is going to need oxygen. So when you're done what you're doing, you can move it back real quick. Now I'm gonna unlock the tray cannula. Okay, Miss Cacho, take some deep breaths in. I'm just removing your inner cannula and I'm gonna clean it, okay? Now move the tray collar back using your left hand. And now I'm gonna clean it.
So now I'm gonna clean it. So put that in the 50% saline and wash it. Then we can take our pipe cleaner and get all the gunk out and clean it really good. So make sure your clean hands is holding onto this top part of the inner cannula. Now we're done with that. We'll rinse it in one of the other smaller buckets. And then we want to make sure to dry because this is going back to the patient airway.
Now it's clean and it's ready to be replaced. So I'm going to reinsert. So move the tray collar. And then make sure it locks into place. Alright, now I don't have to be sterile anymore. And we can clean everything else. Okay, Miss Cacho, we're just gonna clean up around the side a little bit and change your gaze. So one of the first thing we want to clean is the big stuff right here. So get rid of this dressing. So, take one of those 4x4 gauge pad and dip it with your other tray. Remember, we had the 3 compartments and we only used 2 of them. So, the third compartment is what we're gonna use. So, put in the saline solution. And then, clean around the tray side. And also clean the tray collar itself. Now we're gonna use the cotton tip applicator. As we did with the 4x4 gauge, we're gonna dip it again in the saline solution and clean around the tray side. Dip it in. Then clean around the tray side. And then repeat it with the second one. Then always remember to give them their oxygen back. Now, I'll apply the clean gauze with a little slit in it and it goes with this direction. So this is to catch any secretions if the patients happen to cough up on their own. So remove the tray collar. Then natin nag. Now we'll reapply the oxygen. Now I will reapply the oxygen. And the patient is good to go. So, okay, Miss Cacho, I'm finished with what I needed to do. Is there anything else I can get for you right now?
None, sir.
Okay, good. I'm just gonna clean up my area here. And that's all, ma'am. Hoping for your fast recovery.